I'm just gonna. Alright. So the first one is if a patient has a resting heart rate of 60 beats per minute and stroke volume of 70, what is the cardiac output?
4,200.
Sorry?
Is it 42?
Yes, yes. So what is the unit, please?
Milliliters.
Milliliter.
Milliliters per minute. Yes. Okay. Great, you got this. So increasing the heart rate will do what to the cardiac output? Will it increase or decrease? Increase. Yes. Okay. You guys are good. Okay, what are the 3 factors that affect the stroke volume? There's 3 factors, remember, that affects your stroke.
Preload, afterload, and contractibility.
Yes, preload, afterload, and contractility. So afterload is something to stroke volume. Is it directly proportional or inversely proportional to stroke volume? B, inversely proportional. So this means that if we increase afterload, we decrease stroke volume, and if we decrease afterload, we increase stroke volume. Okay, so there's an inverse relationship. What can increase our venous return? So what can increase the amount of blood that's coming back to the heart?
Constriction of veins.
Yes, vasoconstriction, yes, that's one. Do you remember the muscular milking activity? When we exercise and stuff, the contraction of the skeletal muscles around the veins helps propel blood back to the heart. And the other one is inspiration, because when we're inspiring, we're generating that increase in intrathoracic pressure, which acts like a vacuum that sucks blood back to the heart, okay? So muscular milking activity, inspiration, and vasoconstriction. Name a negative chronotropic agent. So first of all, what is a chronotropic agent? Do you remember? It affects heart rate, yes. Chrono, time, so heart rate. What can negatively affect our heart rate? Something that can slow it down.
Beta blockers.
Beta blockers, calcium
channels blockers also.
Yeah, stimulating our parasympathetic nervous system, decreasing calcium, all of this stuff.
Digoxin?
Digoxin, yes. Okay, next one. Is calcium a negative or positive inotrope? What is an inotrope, firstly? What is an inotrope? So chronotrope is something that affects heart rate. Inotrope is something that affects
heart muscle.
Yes, heart muscle, contractility. So is calcium positively or negatively affecting the contractility? Is it making it more contractile or making it less contractile?
Is it positive?
Positive, yes. If we have more calcium influx inside the cell, we're going to generate a higher force of contraction. So it's a positive inotrope. Using it. Okay. How does hypertrophic cardiomyopathy affect stroke volume? This is actually, I don't know, this is hard. Okay, how does hypertrophic cardiomyopathy affect stroke volume? I'm going to give you guys a clue. In hypertrophic cardiomyopathy, remember that our septum and the ventricular wall, they are very thick. So how does that affect the stroke volume?
Does it decrease the stroke volume?
It does. So if we have hypertrophic cardiomyopathy, it means the septum is big and the left ventricle is big. This narrows the chamber space, remember? So this limits the amount of blood that can go inside the ventricle, because instead of the ventricle having like this much space, now because the septum is hypertrophied and the ventricle is like so thick, we only have this much space to fill the blood. So this is going to decrease our preload, which will then decrease our stroke volume. Okay? So yeah, what is this going to do to the cardiac output? If we decrease our stroke volume, what's going to happen to our cardiac output?
Decrease.
Decrease. Yes? Okay. How does systemic hypertension affect stroke volume? So hypertension in the systemic circulation, not in the lungs. How does that affect stroke volume? Is it gonna increase, decrease stroke volume if we have hypertension?
Increase.
Sorry?
Increase.
So if we have hypertension, is it gonna increase or decrease stroke volume?
Increase.
Increase, that was it.
Decrease.
Are you guys sure? Hypertension,
Is
if
it
we have
decrease?
decrease, yes. If we have hypertension, we have high pressure in the systemic circulation, in the arteries. So that means we have a high afterload. And remember, afterload is inversely proportional to stroke volume. So if we have hypertension, it's going to be harder for the left ventricle to pump blood out. So it's going to actually decrease the stroke volume. So it's going to decrease stroke volume. Okay? Is that clear?
Yes, yes.
So again, if we decrease our stroke volume, what's going to happen to cardiac output?
Decrease.
Decrease.
Yes. Last one. What does the Frank-Starling law state? Do you remember?
Higher the preload, higher the cardiac output.
Sorry?
Higher the preload, higher the cardiac output.
Yes. So basically, the more stretch the ventricles get during that diastolic period, the more preload, the more stretch, the higher the stroke volume, and therefore the higher the cardiac output. So that's it, guys. Do you guys need the slides? Because someone was asking earlier.
Yes.
Is this gonna, okay, all right. Okay, guys, that's it for today. So we'll see you all next week, and we'll send you the slides, don't worry.
Thank you.
Okay.
Thank you very much.
Thank you.
Thank you. Thank you.